Hello, good afternoon, good morning. My name is Lee Ullman, and I'm representing the MIT Sloan Latin America office, part of MIT Sloan Global Programs. I'm accompanied by my colleague from Global Programs, Jacqueline Taylor, and it's a real pleasure to be here today with you and have Esteban Moro, Professor Moro, here to present us on the work that he's doing about COVID-19 in Mexico. Esteban Moro is a research scientist at the MIT IDSS, or for those of you who don't know, the Institute for Data Systems and Society. He's also an associate professor at Universidad Carlos III de Madrid. And more importantly, he's someone who we've worked with for the last couple of years, as Esteban has been at the Media Lab. And Esteban has helped us, the MIT Sloan Latin America office, in various of our projects. So Esteban won the MIT Sloan Latin America seed funds. These seed funds are meant to have MIT faculty work with faculty, professors, and institutes in Latin America. And this is one of the projects that was chosen last academic year. And Esteban is here and has been helpful enough to work with us to present some of his findings. So I don't want to take more time, but before we continue, if you have any questions, please use the Q&A, raise your hand, or use the chat. This is for you. We hope it to be as interactive as possible. Esteban has agreed, if you have questions, whether in English or in Spanish, don't hesitate to ask. We'll be happy to answer. And more than anything, hopefully you'll learn something and enjoy the next 50 minutes. So thank you again for being here. Esteban, we really appreciate your time, and I'll turn it over to you.
Thank you. Great. I hope that you can see my slides and can hear me properly. And thank you very much, Lee, for the introduction. And thank you for to the MIT Sloan LATAM office, which provided the support for this project that we are going to present today. So my name is Esteban. Buenos días a todos, for those of you that speak Spanish. We are going to talk about a project that we have been doing with actually with data from Mexico and collaborating with one of the institutions there, the Bancomer, which is the BBVA bank in Mexico. The key concept or the key, let's say, idea of this talk is to try to see if we can analyze what happened in Mexico during the first part of the epidemic. And I'm going to talk about this because why we care. Well, this is actually the map of the last, the plot of the number of reported cases in Mexico in the last couple of years. Those of you that are in Mexico probably know what is happening here. We have a first wave that happened pretty much at the same time like in other countries, and then the different waves, the Omicron, Delta, and the last one during this summer, in which we still see that there's a number of people which is affected by COVID. Obviously, the number of deaths have decreased dramatically because vaccination now is at levels of 70% of the people in Mexico is vaccinated. So unfortunately, I mean, this number of cases do not translate into the number of deaths, but it still is a problem for the authorities and also for businesses, for even, for example, schools, to manage these different waves. And we believe that most likely there's going to be probably another wave or another, let's say, pandemic in the future. So what we can learn about what happened in the past can be used to prevent or to manage the policies and the implications of the different waves in the future. One of the key things about the pandemic and the COVID pandemic in LATAM, especially in Mexico and also in LATAM, is that is what is called the recovery paradox. So most of the big numbers, let's say the macroeconomic numbers in most of the countries have recovered to the levels which were previous to the pandemic. So, for example, the GDP in the United States have recovered in most European countries, etc. But there is something unique that happened in LATAM, and especially, for example, most of the LATAM countries were more impacted by the COVID, in the sense that 32% of all deaths in the world happen in this region, especially, for example, in places like Brazil and Mexico. They have a lot of actually deaths compared to the other parts of the world. And it's actually funny when you see, for example, what happened in 2020, the global wealth in the world grew by 7.5%. And for example, in the US, grew by 12%. Even during the 2020, the year 2020, which most of the pandemic was unraveling, and the most strong, let's say, side of the pandemic was unraveling in the world, Europe and the US were growing at almost 2 digits percentage. But Latin American and Caribbean countries, the GDP dropped, or the wealth, let's say the wealth dropped by 11%. So you can see that there were the impact of the COVID, especially in 2020, was really different in the different countries. And it has obviously not everybody was actually equally affected, even within the countries. For example, most impact was, for example, in the medium to small companies, and especially women. Women were really affected by the COVID, in which they basically lost more than this 11% of the wealth. They were actually closer to 20% of the wealth. Also up to 2021, those countries, not only they were more affected, they were more unequally affected, but also they were less vaccinated until 2021. Now, the vaccination rates, at least one dose, are pretty similar, for example, between Mexico and the US. But in 2021, even still in 2021, there was the numbers were still very small. For example, in the US, there were like 50% of people were already vaccinated with 2 doses. In Europe, the 34%. In Latin America, it was only 11%. So this is what we call the recovery paradox, because if you look at the macro numbers, and if you look, for example, at the government, let's say, reports, most will say that the situation, the economic numbers have recovered to the previous levels before the pandemic, but still we see that there's a lot of people that are left behind and that have actually not recovered 2 years after the first wave of the economic crisis. And we are going to focus today on Mexico. This is basically the picture for Latam, but we are going to focus today in Mexico. And we are going to focus on Mexico for many reasons, but especially because Mexico has a large fraction of the population living under poverty situation. Around 9 million people are living under, let's say, poverty levels. And also Mexico was really affected by COVID, especially during the first waves. Up to today, almost 330,000 people died for COVID-19 related symptoms or disease. And it's actually the 5th country in the world with more number of deaths in absolute numbers. Okay, and we are comparing with countries which are twice or 3 times, 10 times bigger than Mexico. Also, Mexico experienced the largest drop in GDP, one of the largest drops in the GDP in 2020, 8.3, and there were around 1% more unemployed people. Actually, it's funny to see that the unemployment rates didn't change dramatically, but as you might know, the unemployment rates in Mexico are very low. So 1% of change means that it goes from 3% to 5% or 4%, which is huge. The other interesting thing when we are gonna, because we're gonna do a comparison study of what happened in Mexico with other countries, is that Mexico didn't have any stimulus plan, any let's say government federal stimulus plan during 2020, and or the stimulus plans only was like 1.9% of the GDP. So the money that it was given to people that were more affected by the pandemic, like for example, people that lost their jobs or that were working in, for example, as essential workers, frontline workers, etc. The money was only given, it was only like 2% of the GDP. You have to compare, for example, in the US, the money that was given in 2020 was around 25% of the GDP. So the amount of money that was put in place for welfare and for stimulus, economic stimulus, was huge in the US compared to what happened in Mexico. So all those ingredients tell us that Mexico was a special place in terms of the impact of the pandemic, and obviously in terms of the recovery. So what we wanted to do with this project and with the funding that we got from the MIT Sloan Latam office was to try to give more data, to try to understand all the potential aspects of the impact of the COVID-19 in Mexico, and not only on the direct impact, but also on the recovery. And in order to do that, what we did was to try to find a number of partners in Mexico, companies actually in Mexico, that have data about human activity, going from obviously the epidemic data, which we could get from official sources, to how, for example, was the spending of the Mexican, how the Mexicans were affected, how the mobility was affected, or how unemployment was affected. The only way to understand, clearly to understand the inequalities that were happening in Mexico during the COVID, during the first year of the COVID, and also and to understand who was more prone to recover from those initial, let's say, shocks, is the only way to do that is to incorporate individual data, or at least more granular data about how people move, how people spend, how people work, and the number, how people were affected by the actual epidemics. So this is what we have done. And the questions that we try to understand a little bit during the first this first analysis of this data is the threefold. There are two questions about what was the impact of COVID-19 on these activities. Obviously, there was a big shock, especially in March 2020. So we want to understand who were the groups, how mobility, spending, and employment was affected. But also we want to understand which groups were more affected, okay? And also which groups recover faster from that. So which groups needed less, for example, stimulus or less help from the federal government to recover their spending, the mobility, and the employment. So in order to set up this project, what we did was to gather a huge amount of data from many different sources. So we partnered with Bancomer, which is the BBVA branch in Mexico, in order to get aggregate transactions by municipality, gender, income, and type for merchant. Basically, what we have is the credit card, the use of credit card in the whole country of Mexico, and we aggregate these transactions by municipality and gender. We do this for privacy reasons. We don't have individual data. We just have the number of transactions, which is done by different groups of income and gender in each of the municipalities. We also obviously downloaded the data from epidemics from CONACYT, which is the number of cases, the number of deaths, and the number on the municipality. Also working with the World Bank, we partnership with them to get access to the data, the mobility data. This mobility data comes from mobile phones, and it has been broadly used in many of the countries like the US, and in Mexico, the company that provided that data was Veracet. Once again, we don't have individual data. We just have the number of people that stay home, or the number of people that, for example, travel a number of kilometers by municipality, but also by income group. And finally, we downloaded public data from the Instituto de la Seguridad Social in Mexico, Instituto Mexicano de la Seguridad Social, in which basically the IMSS that has the number of jobs by municipality and sector. So the key idea of this project is to put together this data so we can understand this multidimensional effect of the epidemics, and also who were the groups that were more affected and who were the groups that recovered fast. So let me show you a little bit what the data tells us, and I can advance you that what we find is that we can actually we're going to see a lot of inequalities, but we are going to also see a huge impact of the measures that were implemented by the government. And the key idea that we want to understand in this project is that we can quantify who were the groups that are more affected, so we can learn from the next pandemic on the next, let's say, policies. We can build policies which are more targeted to solve those potential inequalities. But before getting into the unequal, let's say, impact, let me put together the results. Let me show you the aggregate national results. So I'm going to show you how spending, mobility, and unemployment was impacted by the epidemic during the last year. By the way, we only have data about the first year for privacy reasons. So this is basically the number of confirmed cases, the number of COVID cases as a function of the date in Mexico. So just so you know, there was not a first wave, like for example in the US, in which in March 2020 we have a number of cases that, I mean, the spike was around April 2020 in the US. In Mexico, the first wave was a little bit started a little bit later. It started about August, which is actually when the second wave happened in the US. But the federal government implemented very different social distancing policies in around the end of March, they implemented what is called a federal lockdown, in which they restricted the, let's say, the access to specific activities, etc. And they started what they call sana distancia, which was basically implementing a number of social distancing measures. So people, for example, didn't go to workplaces, or that some of the places, like for example, restaurants or some of the government offices were closed. After June, until the 1st of June of 2020, the government implemented another phase, which was called Nueva Normalidad, new normality, or reopening, in which they were trying to, let's say, scale down some of the measures that were implemented in sana distancia. So this is, I mean, to make the correspondences with what happened in the US and in other countries, sana distancia was the phase 1, and Nueva Normalidad was the phase 2, let's say, reopening phases. But you can see that what you can see here is that actually the number of cases did not follow, or actually they were not, or did not respond to the implementation of those policies. What did follow the implementation of the policies was, for example, the economic activity in Mexico. Here you can see the number of transactions, the number of credit card transactions in Mexico from our partner, from Bancomer. Everything is normalized to before the pandemic. So you see, for example, that before April 2020, we have like a flat, almost flat curve, which means that this is basically the normal activity is 100%. But then when the federal lockdown was implemented, even though the number of cases was not quite big, the number of transactions dropped up to 33% in the whole Mexico. And we are talking about the mid-April, about the first 2 weeks of April, in which the number of transactions dropped by 30%. Since then, the number of transactions have recovered. So, but still at the end of the 2020, the number of transactions was still 70% less. Just to put this in context, there are one similarity with the US, because the US, the number of transactions, the number of credit card transactions dropped also by 35%. So it's very similar. But contrary to what happened in the US, in Mexico, there was no cases. There were still not a large amount of cases. So it was more, this drop in the number of transactions was, in Mexico, was not driven by the number of cases, but not by some kind of public health, let's say, situation, or let's say country situation, or national situation. Okay. But obviously, not all the activities were impacted equally. People actually, what happened is that people started to spend less money. This is actually the amount of money that people spend in different sectors, in different categories. Each of the lines that you see here is a category. And you can see that what happened before, let's say, April 2020 is what most of these curves are around 100%. But then what happened just after the federal lockdown, and actually the news that were coming from the US and from Europe about the number of deaths, people immediately reduced the money that they were spending in travel and entertainment. So they actually reduced the money around 90% in those activities. So it was a huge decrease in those numbers of activities from one week to the next one. Okay, and the same thing can be done for transportation, for food. For example, people reduce a lot the amount of money that they were food, like around 40%, and also health. They reduce a lot the amount of money that they spend on health, or for example, on utilities. Okay, but not all the activities where the amount of money was reduced in all activities. You can see, for example, that in construction and in grocery there was actually an increase of the amount of money spent in those activities. You can see a bump later in the year in the groceries, and also in construction, and also in art and entertainment. This bump corresponds to Buen Fin. Buen Fin is basically a celebration very similar to Thanksgiving here in Mexico. So there's a lot of actually consumption of goods or food to be with a family, and also in art and entertainment. So you can see that basically what happened is that people actually spend more in groceries, or more in construction, but also in health. From mid-July, people were spending more in health, but in the rest of the categories, the amount of money they were spending was smaller. So that's very simple to understand. What happened is basically that people reduce their money, the amount of money that they spend in non-essential goods, in non-essential personal services. and they incremented the amount of money that they spend, for example, in groceries and in construction. So this is basically probably related to things that they were doing at home, or, for example, things that were happening around, for example, businesses, the modification of the businesses, for example, to get the new measures, etc. Okay, not only the total amount of money that they spend was different, but also the amount of money per, let's say, the ticket, the amount of money that they spend every time they go to the grocery. That was huge. They went, for example, the amount of money that they spent, for example, in grocery, every time they went to the grocery, they spend more money. For example, in some categories, the amount of money increases up to 20%, which means that they spend more money in groceries, but it was because every time they went to do the groceries, they spent much more money than they did before. Okay, so that means that they were strategic about going to do the groceries. They went to do the groceries, but at the same time, they spend more money there, like I know, piling up or getting more stuff, so they don't have to go to the groceries again. The same thing happened with health also, and with food. Okay, so every time they went out for food to a restaurant, they spend more money than it was before. Okay. And the final thing that we did is also to analyze how much of this behavior, like, for example, changing from spending less in food, because it might have been driven by the fear that people have about getting infected in the different places. How much of this actually translated into people using more online purchasing, online transactions? So in the data that we have, also we have the use of credit card online, and this is how the amount of transactions changed. The amount of online transactions changed during the first waves. The first wave in Mexico, you can see that typically before the pandemic, about 5% of the transactions in Mexico were done. Credit card transactions went down. The credit card transactions were done online. But then after the pandemic, it jumps up to 8%. So that 3% more increase, which is actually very small to account to actually explain what is happening here. I mean, these changes of behavior in which people not only change, for example, the amount of money that they were spending in different sectors, but also the ticket size. I mean, the amount per transactions that they spend in different size. So this is basically, and I didn't present the unemployment data because I was showing it before. There was a 1% increase or 2% increase of unemployment during the pandemic, and now at the end of 2020, it's just about 1% more unemployed people in Mexico. So the main messages of this, analyzing this, let's say, aggregate behavior in the Mexico, especially the spending patterns, it was that most of the decrease, as pretty much like happening, for example, in the US, most of the decrease in spending was in non-essential in-person goods, like traveling, art and entertainment, and also food. For essential in-person goods, like, for example, grocery, people tried to minimize contact by making bigger purchases. So what we found is that people were strategic about where to go, how to go, and how to consume. And also what we found is that no, this changing patterns cannot be explained by a huge increase in online purchases. There was a large increase. I mean, it went from 5% to 8%, but it was not explaining the amount of the shift that we saw in specific behaviors, like, for example, groceries. I mean, it was not the amount of the change in amount of people going to groceries, and the ticket size there cannot be explained by online purchases. Okay, so this is the average behavior. So we see pretty much a huge change in behavior of people in regarding the spending, but we are going to also see how much this is related to other behaviors, like, for example, mobility. So here you can see the people we compare two time series. This is the percentage of people that are not at home. Okay, and it's normalized once again. Before the pandemic, everything is actually 100%. So this is the percentage of, this is normalized to the percentage of people that were at home before the pandemic. What you can see is that after the pandemic, just after the federal, for example, lockdown, what happened is that the amount of people that were not at home actually was reduced dramatically, up to 60% more people at home that before the pandemic. And then you see that gradually after, through the year, the mobility was recovered, but it was a huge, actually, part of the mobility that disappeared. And the dotted line that you have here is actually the spending pattern. So you see that they are hugely correlated. The spending patterns and the mobility patterns. And it should, because as I was telling you, most of the credit card transactions in Mexico are happening offline, are happening in person. Only 5%, 8%, 5% of online purchases correspond to online transactions. So most of it is in person. So basically the spending is correlated with getting outside the home. So the mobility is highly correlated with spending. So this is why we are not going to talk anymore about the mobility, because the mobility is really correlated with the spending, and the spending already includes the mobility patterns in Mexico. Okay, so this is the aggregate numbers, big changes in behavior throughout the whole Mexico. But what is more important is who were the people that were more impacted by those changes. Okay, you see that there are some questions in the chat. I don't know if Lee, you can help me, because I mean, I don't know if there's specific questions about.
Yes, we're reviewing the chat, Esteban. So I wrote some message in there. We'll review the chat and the Q&A to make
Okay,
sure.
great, cool. Okay,
Thank you.
okay, thank you very much. Okay, so the next thing for us, which is more important, is that obviously these are the macro numbers, the big numbers. This is the whole country. Mexico is a huge country, and it's very unequal, unfortunately. So what we want to understand is which groups were more affected by those COVID restrictions, in the sense that they lost the spending, let's say, power, or the purchasing power. They lost of some mobility, or eventually they could even lose their jobs. When you look at the spending patterns, you see the plot on the left-hand side. What you see here is the normalized number of transactions as a function of time for different income groups. So blue is the low-income group, and red is the high-income group. This is related. I mean, this is what the same plot for. This is the same plot that I saw before for different income groups, and you can see that the high-income group reduced the purchasing, the behavior much more than the low-income groups, but not too much. Like obviously they reduced much more, like it was like 40% during the first week of April, compared to 25%, 28%, sorry, for the low-income groups. But you see that most of, very similarly, the three groups actually recover through the year, and the differences between them actually narrow. That means that pretty much all the groups were equally affected, but obviously the high-income groups reduced the consumption much more than the low-income groups. In terms of gender, because there's a huge inequality also in terms of income, what I'm gonna show you later, like typically females or male or women have less purchasing power, or less, let's say, income that males. So you can see the same thing here. Like men actually decreased more. Decreased less during the pandemic, but women decreased more during the peak of the, let's say, the first wave. But then eventually, more or less, the patterns become equal, and there's no clear difference between them. Okay, this is actually really different to what happened in the U.S. In the U.S., for example, high-income people reduced a lot the purchasing, the transactions during the first wave of the pandemic, and they actually took longer to recover than the other groups. But low-income people, for example, in the US, recovered the purchasing behavior pretty much after 3 months. Okay, and that was due, obviously, to the stimulus checks. So the stimulus plans that were in place in the US actually were money that was given mostly to low-income populations, and this helped, and all the measures, not only the stimulus plans, but also, for example, unemployment benefits, for example, the deferred rental agreements, etc. All these measures help low-income people to recover the purchasing behavior or spending behavior much faster in the US than in Mexico. In Mexico, as you can see, high-income people were still recovering the patterns, but low-income people did not go as fast as they did, for example, in the US. Okay, so this is a striking difference between US and other countries, because perhaps, for example, this has been analyzed also in the UK and also in Spain, in which the purchasing behavior of the spending behavior of low-income peoples recover much faster than what happened in Mexico. And the difference across income groups is higher in some categories. For example, we see that food, for example, in food, also high-income groups are spending, even after 1 year, they were spending less money on food that low-income people. In groceries, more or less everybody's, I mean, the three groups are very similar. But in health, for example, low-income people are spending much more. After the first wave, they were spending much more than they did in the past. Okay, after, let's say, a dip during the first wave, they were actually spending much more. And the same thing you can see, for example, in transportation, traveling, more or less the groups were behaving similarly, but not in utilities. In utilities, for example, the high-income group was spending a little bit less than the low-income groups. So you can see here that most of the categories in which there was a striking differences were food, health, or travel. Sorry, or travel and transportation. Okay. And the question is why? The question is why we see these striking differences. And let me just show you something that we found before the pandemic. So this data is actually before the pandemic. What were spending different income and gender groups? So as you can see, we split this into three plots. I'm sorry, the one in the middle should be mid income, no low income. So it's low income, middle income, and medium high income. Sorry about that. This is a problem with the labels. So from left to right is low income, middle income, and high income. And the bars that you see here is the amount of money that they spend in the different categories, and it's a split between female and male. As you can see, for example, in low income, females are actually spending much more than the male, and especially in categories like, for example, groceries and shopping. But if you go to high income, is the opposite. In high income are mainly male, which are spending money in transportation, in shopping, and in groceries. So you see there's a striking difference between low income and high income groups, not only in the amount of money that they spend. For example, in low income, the amount of money that they spend in transportation is very small, while the amount of money that is spent in high income transportation is huge. Okay, and in transportation, I'm talking about everything, like, for example, like tolls, like, for example, public transportation, but also Uber, etc. And the other thing, for example, you can see, for example, is food. High-income people spend much more on food than low-income people. So this is before the pandemic. So this is before the pandemic started. But as I was telling you, most of the activities that were impacted were transportation, groceries, and shopping. Okay, so you want to see in a minute that because those were the activities that were impacted, different groups actually recovered differently because they were spending differently before the pandemic on those specific categories. In order to understand who recovered faster, what we did is basically to define the recovery rate of a person, of a group. So what we mean is the following thing. You can see the plot on the left-hand side is basically for each group, let's say salary / gender / municipality group, we build a time series in which we analyze the normalized spending, and we say that a group has recovered if their spending is equal or above what they were spending before the pandemic. So this is what we mean by a recovered, let's say, spending pattern. And a group is not recovered if the amount that they are spending is smaller or is significantly smaller than what they did before the pandemic. And the plot on the right-hand side, what you see is that for the different combinations of income and gender, what is the fraction of groups that recover? So you see, for example, that 65% of female low-income groups have recovered their spending. And this is very easy to understand because, as I was telling you, most of the spending of female low-income groups was in groceries and shopping. And those categories almost recovered at the end of the pandemic. While only 46% of male high-income groups have recovered their spending. And that's, again, very easy to understand because, as I was telling you before, male high-income groups were spending more on transportation, shopping, and food, which were the categories which were more affected by the, let's say, the social distancing and another, let's say, type of behavioral changes. Okay, so as you can see, the different groups that have recovered are very different, and mostly the spending that has recovered is basically the female low-income groups. So they basically come to the levels that they have pre-pandemic, but the male high-income groups have not recovered their spending, which means that mostly the impact of the the COVID in spending patterns was that high-income people actually reduced dramatically their habits, their behavior, spending behavior. Okay, so once again, to summarize this part, what we see is that there was an equal impact of the COVID-19 spending. We see that all income groups decreased their spending, especially high-income groups and male. And the difference across groups is more evident in non-essential goods, like, for example, travel, food, and transportation. Because women were not actually spending a lot of money in those categories, women were the first ones to recover the spending patterns. Okay, that doesn't mean that they will not need stimulus, for example, economic stimulus. It means that they basically were not spending a lot of money in those categories to start with. Okay, the final thing is that, okay, this is basically how people changes the behavior, but what was the impact of that? What was the economic impact of the epidemic? And we are going to actually answer that question in 3 different aspects. So the first one is that obviously there was an epidemiological situation. There were a number of people, unfortunately, have to go to the hospital, or that were quarantined at home, or that unfortunately they died because of COVID, of the virus. The epidemiological situation brings two things. One is awareness, like, for example, the number of cases and the number of deaths. So I might, for example, all of us were following probably the New York Times every day, like seeing what were the number of cases, making predictions about what is going to happen tomorrow, congratulating ourselves because the number of cases were dropping, etc. Everybody was actually aware of the number of cases and death. The other thing that happened is that the governments were trying to reduce or alleviate the number of infections by implementing mobility restrictions. This sana distancia, for example, here social distancing metrics in the US, trying to reduce the number of cases and the number of deaths. Both things, like I mean, reading about the number of cases and number of deaths, and also the mobility restrictions. I mean, the fact that my favorite restaurant has to close, had to close down because of mobility restrictions, or sana distancia, or social distancing, that all of them impacted the change of the spending. So what we are trying to to see is what were the impact of those things that you have in the middle on the change in spending. Why people changed their spending, and it was because of the number of deaths or the number of cases that they have in the municipalities, or it was more because of the mobility restrictions that they have implemented by the government. And the good thing about Mexico is that it's a huge country. So the number of cases, for example, that were happening in Ciudad Juárez, which is the plot on the left-hand side, is very different from the total number of cases that were happening in Mexico. Okay, so different parts of the country have different waves, different moments in which they have. Obviously, there was a lot of actually synchronization because a lot of the waves happened more or less at the same time, but there were particularities. For example, the second wave that happened in October in 2020 was really huge in Ciudad Juárez compared to other municipalities. And that's good for the point of view of the study, of the research, because we can use this variability on the number of cases to study how people responded in different municipalities to different, let's say, inputs, to different conditions. So this is what we did. What you see here is to try to find what is the correlation, between the change in spending and the number of cases in that municipality. So if the correlation is positive, I change my mobility when the number of cases goes up. So for example, I hear in the news that in Ciudad Juárez, yesterday there was an increase of, I don't know, 10% in the number of cases, and then I decided not to go to the supermarket because it's getting risky. Okay. As expected before the pandemic, before the federal, let's say, before April, the correlation between the change in spending and the number of cases was 0, because the number of cases was very small. I mean, there were like 1-2 cases in Mexico City, or I don't know, or for example in Nuevo León, etc. There were very small number of cases. But when the federal lockdown was implemented, we saw that that correlation became very significant and negative, meaning that an increase in the number of cases reduced the spending. Okay, so that's the negative. It means because it's increasing the number of cases, an increase in the number of in the spending. So it's negative, means an increase in the number of cases, reduced the number of the spending. But interestingly, that lasted just for a couple of months. after a couple of months, people actually were not spending accordingly, or they're not reducing their spending accordingly to the number of cases. So in the second wave of the pandemic, spending was highly independent of the actual epidemic situation. We can argue of a lot of reasons why this is happening. There's obviously one of the reasons is that the number of cases reported was not actually reflecting the epidemiological situation, but also the fact that people changed their behavior completely. So during the first, let's say, 2 months, people were reacting, they were adopting the behavior to the number of cases, but then after the first phase, they actually find a way to keep spending, but at the same time minimizing the exposure. We learn also a lot about, for example, wearing a mask, how the virus is transmitted, etc. So that could also reflect the fact that people were not longer afraid of getting outside, even though the number of cases was increasing. And even, for example, during the different, let's say, waves. You can see here, for example, at the end of the year, that during the Omicron and the Delta, that there was a little bit of anti-correlation, meaning that people are a little bit of adaptation to the number of cases, but not too much. And the same thing happened with mobility. What we saw is that the mobility, contrary to the spending, the mobility was correlated. So this is the number of people that stay home. The change in the number of people staying home, how it correlated with the pandemic, and you see that the correlation is more or less positive for the whole year, meaning that people were afraid. So even the spending was not correlated. The mobility, I mean, actually going to places was highly correlated with the number of cases. Although the correlation is going down, meaning that in 2021 probably there was no correlation between how people move and the number of cases. So this is entanglement between the epidemic situation and the spending and the mobility at the end of 2022. Not everybody actually adopted the behavior equally. For example, during the first phase, what we saw is that the reduction in the spending in the high-income groups was larger, was more correlated with the number of cases. So high-income groups were more aware of the epidemic situation. They were adapting the behavior much more than low-income people. This could be also an unequal, reflecting the unequal opportunity that people can have to social distancing themselves. Like, for example, there were people in low-income groups which could not actually afford to stay home because they have to work, and so they went outside, or they spent independently of the epidemiological situation. And the same thing happened with mobility. You can see here that from July, high-income people actually became even anti-correlated with the number of cases, meaning that they were moving more. This is probably because they could have other residents or other places to go. And obviously not all purchases were affected. I mean, this is the correlation of the money spent or the change in the money spent in different categories with the number of cases. And what you see, for example, is that the consumption in food, shopping, and traveling was more reduced in areas with high COVID rates. You can see, for example, food, the correlation is very strong, and also in the shopping and also in the travel. But on the contrary, groceries were actually more correlated with COVID cases. So the more COVID cases that we have in the city, the more people were spending in groceries, probably as a panic reaction to probably problems with logistic, let's say, or the supply chains, or also the thing that they were spending more time at home. The thing that they were going to spend more time at home, they need more groceries. The final thing is that obviously the part of the spending that happened, or part of the decrease in spending that happened during the pandemic, was due to the government measures. The government implemented what was called the semáforo, traffic light, in which they have different social distancing metrics that were from the red one to the green one, in which for the red one, basically nothing was allowed, and in the green one, everything was allowed. So, for example, in the red one, all the public spaces were closed, all the vulnerable people have to stay home, and the schools were closed. In the green one, the schools were open, and the only thing that was implemented was like some kind of 6 feet social distancing, etc. This is how the different states in Mexico implemented the semáforo, and you can see here the severity goes from green to 4, and you can see that different times also different states at different times have different, let's say, semáforo lights. what we're trying to do is what was the impact of those policies in the change of spending. So, for example, every time the yellow light was implemented, what was the change in spending? And if the yellow goes to red, what is also the increase in changing? So what we find is actually that the social distancing places, just when the semaphore started, on average, the impact on spending was like a 3%. Okay, so every time the semaphore, any of the semaphore actually lights was implemented in a state, the spending dropped 3%. And all income groups were affected, but especially high income people. For example, when the red light was implemented, let's say phase was implemented in a state, the drop in the spending by high income people was about 15%. Okay, and low income people actually were not affected and by the yellow and the green ones, but they were affected by the red ones. Okay, which also reflects once again the possibility that what happened is that low-income people couldn't afford actually to stay home, even though there were restrictions to move around. Okay, so that this is very important because it tells us that every time the policy was implemented, that amount to 3% changes in the spending. All groups were affected, but especially the groups that reduced the consumption more importantly were high-income people. And the final thing of the project was to try to see, obviously, when you stop spending money in food, obviously the big question is what is the impact of unemployment and in food, for example, in food places. If I reduce the reducing in services, in spending in services the money spent in services is reduced, obviously there's going to be unemployment. So this is the employment of the different sectors in Mexico, how it evolved. Obviously, once again, normalized to be 0. This is the change in employment. And you can see, for example, that manufacture and assembly, medical services, the change in employment was not dramatic. But other sectors like agriculture, food preparation, recreational, or temporary accommodation services were highly impacted. Actually, the employment in those sectors dropped up to 30%. The other thing that you can see here is that the drop, the minimum or the maximum impact on unemployment happened around summer, not just after the policies were implemented or the change in spending. So the change in spending in March impacted the unemployment in July. Okay, if there is any impact. So this is what we have done. What we have done is to try to study what the change in spending during the April. Okay, and if this is correlated with the unemployment in July. Okay, so we did a number of regression models. I'm going to show you in a minute. I can show you also the technical details of the regressions. So what we found is basically is that 1% change in spending in April resulted into 0.3% change in employment. So every peso that was not spent in the whole economy in Mexico during April 2020 translated into a change of 0.3%. 1% change in spending went into 3% change in employment. And that is actually much bigger for some sectors. What we found, for example, is that in food or in shopping, that amount, actually this 0.3%, amount to 0.4% or 0.3% in employment. So there's a clear correlation between the change in spending and the unemployment in those sectors, which means that if we use the results that we found here, okay, every time the semaphore was implemented, that translated into 6%, let's say, change, and that translated into around 1.8% change in unemployment. So the semaphore was actually, and the policies that were done were translating into changes in employment. Okay, I'm gonna go just to the last slide because Lee is pushing me, is almost getting the mic. So the first result is that we saw a large decrease in spending in non-essential goods and all over Mexico. All income groups were actually decreased their spending, but especially high income groups and male. These are the groups that decreased. So this crisis in terms of spending was like a high income male reduction in spending that translated into, let's say, losses in employment in different sectors, like, for example, food or services. The reduction in spending was mainly driven by health concerns. What we saw, for example, is that during the first wave, people of high income reduced their activity or the spending much more than the other groups. And more or less 1% reduction in spending translating to 0.4 loss of unemployment. This is actually probably the first time, that this connection between the social distancing policies and the spending and the loss of employment has been done in Mexico during the COVID times. And social distancing policies affected especially high income spending. Its implementation of the semaphore costed about 3% reduction in spending. So what we're going to do now, okay, of course, we don't have all the answers. So what we are going to do is open them up, open the data. So we are working with the bank and with the mobility and our partners to actually provide this data so everybody else, especially the people that have interest in Mexico, can understand what's happening, and probably you come out with other questions and other interesting problems that you want to analyze with this data. I think having together the spending, the mobility, the employment, and the epidemic situation can give us unique perspective of how the Mexico recover, but also can help us understand in the future how we can implement policies which are more targeted, less optimized, and more optimized and less more beneficial to all the groups, especially the most vulnerable groups in Mexico. Thank you very much. I'm going to say thanks to my colleagues at MIT, at the World Bank, at BBVA, and also Grand Data for collaborating in this project. Thank you very much.
Thank you so much, Esteban, for sharing this. It's really fascinating to see something that we all lived through, getting a sense of what actually happened. So if anyone has any questions, please feel free to ask in the chat or the question and answer. But Esteban, I'll start off with one question. So you showed the comparison between Mexico and the United States as the baseline. Do you have any knowledge about what happened to Mexico in comparison to other Latin American countries or to other low-income countries? What was the reality of Mexico with people that are more on level or equivalent to Mexico?
Yeah, that's a very good question. We haven't done this. We have actually data also from Brazil. Pretty much the same thing happened. Like the decrease in spending was basically mainly in high-income groups, and that translated into loss on employment, which and also the lack of stimulus, let's say, packages actually made the low-income groups more affected, like by the COVID situation than in the countries. But even Mexico is not the most vulnerable country that we can think of. There are other countries in which the situation was more dramatic, but unfortunately we don't have data, for example, on countries like Honduras or countries in Latin, which that really have a very, very severe situation in terms of epidemics, and economically were not, and also for the point of view of infrastructure, they don't have in place the framework to solve all these problems. But that's a very good question.
Yeah, so if there's anyone in the audience from another country that has good data for Esteban and his team, please reach out to him or to us to help us out, because it would be interesting exactly what you're saying. I know that in some countries, Chile, they didn't give a stimulus, but they allowed people to take money out on their pension. And I think some other Latin American countries. So I wonder if that would have caused a blip into your low income model, being that I know that in some countries, people bought cars and televisions, large ticket items with those stimulus. So I wondered what that would do to the interactions, but it would be fascinating. Not clear, though, if they bought it with credit cards, right? So maybe the retail stores would be able to help you with that.
Mm-hmm.
And then my last question, to let everyone go on time, is what is the next steps with this? What do you hope to do with this information? Are you sharing this with the Mexican government or with other groups to see when that next pandemic or the next major health crisis occurs, what is the economic and mobility aspects to it?
So obviously one of the next things that we want to do is to actually open the data. So basically, so people can have in the same place. This data is very, very varied. I mean, it comes from many different sources, and you have to normalize the data when you wanted to put together. So we made a huge effort of putting the data together, finding which is the regional unit, the anonymizing the data, etc. So there's a huge part of the project which is not very flashy and is not very interesting, but it's a huge work that has been done by Bernardo and other collaborators here, and putting the data together in a normalized way, so people can actually use it directly without having to think about what is a municipality, or where that comes from, or is the same kind of data, etc. So that's the first part of the project. The second part is that we are working also with the World Bank, and they're interested obviously in using this information to inform future policies about, for example, economic stimulus. I mean, what it is needed to help governments or other agencies to quantify the impact of the policies, but also to see what it would be the effect if you have stimulus checks in place, for example. And the final thing that we want to showcase this as a way of a partnership between private and public parties, in which we can put together, for example, banks and mobility data companies, and even, for example, the World Bank or institutions like MIT, to show that this data can actually have a tremendous impact in understanding the effect of policies, and almost in real time. So that's another way. I know that there's a long path to walk in this direction, but just by showing that this is possible, that this partnership is possible, can help in the future. Hopefully, there will be not many pandemics in the future, but can help in other situations, like, for example, natural disasters, or humanitarian crises, or even, for example, in probably many of the sustainable goals that we have for in the future.
Excellent. Well, we've come to the end of our time. Esteban, thank you very much. Thank you to the team that you worked with. This is exactly what we were hoping for with the MIT Sloan Latin America seed funds, and we would love to hear more about this project. Thank you, everyone, for being here. Thank you to MIT Sloan Global Programs, and to Jacqueline Paris, and to everyone who has helped out with this webinar. So, Esteban, always great to see you. Take care and be well.
Okay,
Bye-bye.
thank you very much. Thank you.